Kia ora team, my name's Ben and let's talk pulse pressure. Pulse pressure is the difference between our systolic blood pressure and our diastolic blood pressure. Systole is when our ventricles contract, so our systolic blood pressure is the pressure our blood exerts on the walls of our arteries when our ventricles contract. And then diastole is when our ventricles relax, so diastolic blood pressure is the pressure on the walls of the arteries from our blood when our ventricles relax. Cool. If we look at a normal blood pressure, it's 120/80, 120 systolic, 80 diastolic. So our pulse pressure is 120, take away 80. So a normal pulse pressure is 30 to 40. Alright, so when we have a wide pulse pressure, what's happening? So a wide pulse pressure, it's going to be caused when our systolic and diastolic move further apart. An example of this would be as we age, our arteries get stiffer. So you imagine during systole, we squeeze blood out of the heart, but it's going into arteries that aren't elastic, so won't stretch. So the same amount of blood going into a smaller space that doesn't give is going to give higher pressure. Wide pulse pressure. Same type of thing is going to occur with atherosclerosis. Atherosclerosis is when we get stiffening and also laying down of plaques on the inside of our arteries. Same situation. Another time we get widening of pulse pressure would be increase in stroke volume. So potentially drugs can increase the contractility of the heart. Another example would be hyperthyroidism. With hyperthyroidism, it increases the contractility of the heart, so more stroke volume, and at the same time it dilates our arterioles, so decreasing the resistance, therefore decreasing diastolic blood pressure at the same time as increasing systolic. We also have aortic regurgitation. Our aortic valve is the one between our left ventricle going to our aorta. So if we contract our left ventricle, blood shoots out of the aortic valve into the aorta, and that's our systolic blood pressure. But instead of the valve shutting and sealing off nicely, it allows some backflow of blood into the left ventricle. This is going to increase blood in the left ventricle, so preload, and the left ventricle stretches, and just like stretching a rubber band, the more you stretch it, the more it's going to snap back. So with aortic regurgitation, we get more of that snap back and a higher systolic blood pressure with each contraction. Another time is anaphylaxis and sepsis. So with these situations, we get a massive amount of vasodilation. Our blood vessels open up, and therefore our diastolic, our resting blood pressure, is going to be less because our pipes are big and there's less blood to sit in that pipe. And also, our heart is going to try to compensate by contracting harder to try to maintain that systolic blood pressure. Alright, narrow. So a narrow pulse pressure is going to be the opposite. If we have nice elastic arteries like we do when we're young and we had hair, then during systole the ventricles contract and our arteries are going to stretch nicely. If the arteries stretch, then there's more space for that blood to sit in and less pressure. So our systolic is going to be less and closer to our diastolic. If we have decreased stroke volume, that is going to lower our systolic blood pressure and bring it closer to our diastolic. So an example of this would be hypovolemia if we have decreased blood volume. So either through bleeding or through dehydration. Less blood volume means less blood returning to the heart, less preload, therefore less systolic pressure when the ventricles contract because there's less blood to eject out. The opposite of hyperthyroidism is hypothyroidism, and in that case we have less contractility of the heart, so therefore less systolic blood pressure. Heart failure, so a failure of the heart to generate enough cardiac output is going to decrease systolic blood pressure, bringing it closer to diastolic. Aortic stenosis, this one, our aortic valve is a bit creaky and won't open properly. So now when that left ventricle contracts, it's got to push against the ventricle and it's going to struggle to squeeze enough blood out. That's going to lower our systolic blood pressure. Cardiogenic shock. This is anytime we have a failure of the heart to generate sufficient cardiac output. So it's not able to pump effectively, lowering our systolic blood pressure. And then cardiac tamponade. Our heart is wrapped with 2 layers of glad wrap filled with fluid. That's a good thing, but if there's a buildup of fluid between those 2 layers, then the poor old heart in the middle is going to start getting squashed. If the heart gets squashed, it's going to be hard to fill the ventricles with blood, and it's going to have trouble contracting enough blood out. So cardiac output is going to drop, therefore systolic blood pressure is going to come down closer to our diastolic. Alright team, there we have pulse pressure and the difference between wide and narrow. Happy studying!